Hi, I'm Dick Rodgers and I've come up from Birmingham to Staffordshire General Hospital, which you can see behind me. There's the main entrance. The A&E already is closed at night from 10 o'clock until the next morning. Now, this hospital has just been taken into receivership because of the mess that has been made here, which is it's so famous for. But this is not the fault, I don't think, was the people here. The fault is the way the NHS is run these days, and taking it into administration rings lots of alarm bells for me, because when things are taken into administration they're often sold. And I think this hospital is in danger of being sold to the private sector. And the private sector will make it work because a lot will hang on it. Already there is one district general hospital in the private sector, and they're trying to make it work. But the trouble is, it's not the right way to run a health service. You can't run an efficient health service and a compassionate health service when the relationships within that health service are by contract. It gets terribly complicated. And really, if you're wanting to make money out of something, go and make something for export and keep the country running. Don't involve yourself in the health service, please. I don't think this hospital should be closed. It's a district general hospital. When they were devising where to deploy district general hospitals when the NHS was young, they decided wisely to have one here. And I think the population around here, which is considerable, needs it. It's quite a long way to Birmingham and to Wolverhampton, or I've just come on my Honda 125 motorbike. It's a long way. It's about 30 miles from Birmingham, and I wouldn't want my child or myself to have to go that journey to get to Birmingham. I realise that there are lots of people who have campaigned a lot about this issue and about the bad things that were done here. It's a wake-up call. The health service should not fall into the hands of commerce. The Health and Social Care Act is a disaster, and it should be repealed. And I want to link up with those who care about this hospital and about the NHS in general to work for a service which is true to Aneurin and Bevan, who have originally conceived it. And the NHS should be run as a public service because we care about each other, not as a business to make money out of. I'm sorry, that's the wrong, it's completely, commerce is not the right model for the NHS. And I especially see this in the care of elderly people, because that's almost all done now by businessmen. And we shouldn't, it's something we know we're going to have to do a lot of. We shouldn't entrust it to the hands of businessmen. We should get our act together. We should do it under the care of the National Health Service, both care of people in their own homes and care of people when they need more residential and nursing care. And there shouldn't be a divide between one pot of money paying for it when they're able to look after themselves to some extent, and a whole different funding stream to pay for them afterwards, because then there are endless arguments to try to deprive them of their care and deprive the funders of the responsibility. So look, I would love to be in touch with the various people who care about this hospital, who have done valiant work, and I see them on television. But we need to rescue the National Health Service from commerce. It needs to be a public service, and it needs to be run with a public service ethos and not a commercial ethos, much more simply, so that the people who run the service are part of the same team and not related to each other by legal commercial contract. Thanks very much. Here's Stafford Hospital. I don't know what happens in that building there. I could probably find out. There's the main entrance, and the A&E entrance is the other side of that. It's a very nice site. If I turn around here, you can see the beautiful hills of Staffordshire over there. Beautiful site. And here's a bus coming to deliver people. I think this is in essence a decent premises in which to run a hospital, and I bet there are plenty of people here running this hospital who care a lot about the people they care for. It's just that the organisation of the place and the national organisation has not been set up right, and it's the politicians who should take the blame and not those who are involved in running the service. Well, no, well, I think they may have done some things wrong too, but basically it's the way we've set it up politically which is at fault. I think I'll pop in and have a look around, but I better not use my camera in there. They might rumble me. Right, so I've been and had a snoop around this place. It's a lovely looking building. That's, by the way, that's the physio department over there, and I went up to see trauma and orthopaedics because I've been a sort of orthopaedic surgeon, a clinical assistant in orthopaedics, partly because I got interested in so many other things I didn't become a consultant. But I've been on the inside of the NHS for 17 years or so. It looks a perfectly decent place to look after people. I think it would be a great tragedy if it was shut. I think it would be a great tragedy if it was sold to the private sector, or if the private sector were brought in to run it. And I would imagine it's very likely that lots of people who care a great deal about how they look after people work here. And I think the troubles of Stafford Hospital are very likely to be a symptom of a national way in which the politicians have set up the National Health Service. And I want a National Health Service which is a public service where people work happily together as part of the same team because of the link of team spirit, of being a team, fellow members of the same team, rather than contractors whose relationship with each other is determined by lawyers and by making money. That's not the right way to do it. The trouble that has come about here is because the National Health Service is being run according to the wrong model, and we need to get back to a public service ethos. If they want somebody to run this hospital, I've got lots of other things to do, but I wouldn't mind having a go of doing it. I'd do it for £25,000 a year. Here's accident and emergency. There's the department up the hill there, and here are the gates that they shut at night because it's closed now from 10 PM to 8 AM. Pity, really. And then here's my little motorbike that I came up from Birmingham on, and I don't know if you can see, but here's my mileometer. That said it ended in 92 on the Hagley Road in Birmingham. So it's about 30 miles from Birmingham, which is the largest, well, one of the largest regional centres. The hospitals in New Cross Hospital in Wolverhampton is a bit nearer, but these people need a proper district general hospital, which they've got here, but it's just a matter of how it's run.